Now we'll discuss the general outline of somatic nervous system and the autonomic nervous system. We'll compare them. This is CNS. These are representing the effector organs. Now, this is the afferent pathway. This is the efferent pathway. In case of somatic nervous system, external stimuli stimulates the receptors. Receptors are usually located in the skin as cutaneous receptors or in the musculoskeletal system. Thereafter, the neurons will arise, the sensory neurons forming the afferent pathway of somatic nervous system will arise, and they will end in CNS. This may include 2 to 3 neurons. After ending CNS, efferent pathway arises. Efferent pathway starts from motor cortex or motor area. Now this is the efferent neuron that will start from the motor cortex in CNS and will end in the effector organ, which is usually a skeletal muscle. Now, if ANS is being discussed, then the stimuli starts from a visceral organ. Which reaches the CNS via 2 to 3 neurons. So this is the afferent pathway. But in ANS, sympathetic nervous system and parasympathetic nervous system give different origins for the efferent pathway. For example, if SNS is taken in consideration, then intermediolateral horn in a spinal cord from T1 to L2 will give rise to the first neuron, that is pre-ganglionic neuron, and there is another neuron which is termed as post-ganglionic neuron, which will end on effector organ. But in case of parasympathetic nervous system, either the pre-ganglionic neuron will arise from the cranial nerve nuclei of 3rd, 7th, 9th and 10th, or it may arise from intermediolateral horn in S2, S3 and S4 component of spinal cord. So this is the first neuron arising from CNS in case of autonomic nervous system or parasympathetic nervous system, and this is pre-ganglionic neuron. It is very long and gave rise to post-ganglionic neuron. We can clearly observe that the pre-ganglionic neuron of sympathetic nervous system is relatively shorter than pre-ganglionic neuron of parasympathetic nervous system. The ganglia is comparatively more close to CNS, and in case of parasympathetic nervous system, the ganglia is more close to effector organ. In case of autonomic nervous system, effector organs may be cardiac muscles, smooth muscles, or glands.